portable tool with a hard-to-clean design may be the source of a superbug outbreak in the U.S. Health officials are investigating the cause of the superbug suspected in 2 deaths at a Los Angeles hospital. Nearly 200 patients have been exposed to the antibiotic-resistant bacteria known as the CRE. The hospital says it was likely transmitted by contaminated medical scopes used during procedures. CRE can cause infections of the bladder or lungs. Symptoms can include coughing, fever, and chills. For more on the superbug outbreak, Dr. Ford Vox joins us now from Atlanta. He's a physician at Atlanta's Shepherd Center and practices brain injury medicine. He's also a journalist with a focus on medical practice, healthcare policy, and medical science. Welcome back to the show, Dr. Vox.
Good evening, Elaine.
First of all, does this superbug put the general public at risk? Do you think we could see something like this outside of hospitals?
We shouldn't. In fact, there may be a number of carriers of this bug outside of hospitals already who are perfectly healthy. In the same way, the number of people are carriers of other bugs, for example, MRSA and VRE, from which you can become very ill if they happen to enter your bloodstream and perhaps you are suffering from another illness. This is something people do need to be worried about, though, when they are hospitalized and about to undergo a procedure such as this.
Well, how often does something like this happen, especially when you think about all the medical equipment being used every day around the world? Is something like this pretty rare or more common than we think? And I know you mentioned 2 of the more common things you could pick up at a hospital, but we're really only hearing about this right now.
That's right. Well, this bug is the most dangerous of those that I mentioned, the CRE kind of class of organisms. They really started to emerge around the turn of the millennium. And it's something that not every hospital has experienced yet, but it's spreading, and before long it will reach every hospital. The CRE organism is named CRE because it's resistant to kind of our last best hope class of antibiotics. And in order to fight off these infections, once you are actively infected, it becomes very complicated. We have to reach back to some older chemical compounds that we developed in the 1950s, for example, the polymyxins that are more toxic to the body, and to use combinations of antibiotics that are not always effective, and this organism can be deadly in up to 40% of patients.
This all sounds very scary. You mentioned sort of the course of treatment. What's happening behind the scenes right now as we're hearing about this? I know they're reaching out to people who have been exposed to this superbug, but I mean, it sounds very dire.
Well, this is the largest outbreak that is on record thus far, the one at UCLA Hospital, affecting 179 patients that are potentially exposed. Of course, we only know of about 7 of those patients being infected, 2 of which have passed away. What's going on in the background, there are some questions about that. The U.S. FDA is certainly on the case. They say they've been tracking this for several years now. There have been increasing reports in the medical literature of this bug being linked to this endoscopic procedure. The question is what to do about it. And the FDA has actually been frank. They said in a statement yesterday, we don't quite know. We don't know if this scope can really be properly decontaminated. There are a couple of different procedures some hospitals are using. Neither of those procedures has yet been officially recommended by the FDA.
What recourse do patients have when they're about to undergo something like this, or they're going to be treated? I mean, can you ask your doctors about how things are sterilized, or how can you be sure that you will be safe?
I would. If I was undergoing an ERCP tomorrow, I would certainly want to know from my gastroenterologist, how many scopes does the hospital have, and do you take them out for a few days, perhaps swab them down, or use some of this highly toxic gas, the ethylene gas, to potentially kill the organisms. Those are a couple of the steps that some of the hospitals that have been affected by these outbreaks are using. These scopes are very expensive, ranging upwards of $80,000. Obviously, it's a big investment if a hospital is going to be able to really decontaminate them, and laborious procedures that are going to take them out of action for a while. Hospitals may have to spend several $1 million.
All right, Dr. Ford Vox in Atlanta, Georgia, thank you so much